Hello everyone, we are with Filiz today. Can you tell about yourself?
Yes, my name is Filiz. I'm from Germany. I'm married. I'm 39 years old, and I have two children in the age of 7 and 10 years.
Okay, so now you're in Istanbul Bariatrics. You had surgery with us. Filiz she's a 39-year-old woman who used to suffer from morbid obesity. She had a BMI value of around 40, and she had metabolic syndrome. And we operated on her like 6 days ago. We are proud that she came all the way from Germany to have this operation with us, and we also shared the peri-operative videos that we did with her, with our other patients. So how was all the procedure for you? I mean, can you describe your traveling here and then pre-op checkup, and then you had the operation, you were hospitalized for 3 days after the operation. This is our routine. So how was it?
Okay. I decided to come alone to Istanbul because my husband has to stay at home with my children. I looked and yes, I came with the plane from Germany,
of course, yeah.
And in the airport I was taken from a private taxi to my hotel next here from the hospital. Monday I got a check-up with 8 doctors. It was very professional for me because I'm living in Germany, but I never had a professional checkup system with top doctors like here when I was when I'm in Germany. It was a very surprise for me. And at the end of the day, I was more than 100% sure that these operations will be my way to got my
Yeah, I mean, doing so will solve a lot of problems.
Yes. I was not fit as when I was young. Because I was obesity since I was a child.
Okay.
I have did many diets. My whole life diets. I get up kilos, then they came back.
This is called yo-yo syndrome.
Yes.
And since you had insulin resistance, it's very difficult to maintain, weight loss only through dieting. And when a person starts to suffer from yo-yo syndrome, I mean, you lose like 25 kilos. The next 6 months you regain like 30 kilos. And if this occurs at least 2 times and more than 2 times, then actually those morbid obese people are candidates for operation.
Normally I'm a very disciplined person, but
it has nothing to do
this is a war with the kilos, and I've never won it. And I've never lost so much weight that I say, okay, it's good for me. I'm not ill. Obesity is an illness.
But now you had the operation, and hopefully this vicious cycle is broken now. So there is no way that you're not gonna lose weight in the upcoming year. We call this the first few years after surgery, the honeymoon period, in which patients, regardless whatever mistakes they are doing, they will lose weight. But you should always know that about 10 to 15% of patients who are undergoing weight reduction surgery will end up being morbidly obese again after 5 or 10 years after surgery. So in order to be able to avoid being in this 10%, there are things that you should do too from now on. First of all, in the first year, actually, when you are losing a lot of weight, we will help you to lose this weight preferentially from your adipose tissues, from your lipids, you know, from the fat you bear on your body. So first few months when you are not able to eat proper meat, since you will be unable to get enough animal protein to your body by biting on meats, you should take this protein solution that the sports guys are using first 3-4 months, and then you should also incorporate exercising in your life. Also, you should work on some of your psychological eating problems, that you should know you shouldn't take empty calories. Anything melts in the mouth is bad for you. You know those things, but you should work on them.
Yes.
You should work on your psychological eating habits too. You should incorporate exercise more and more to your life, and then also alcohol consumption should be, you know, at a minimum level, because your genetic code, your metabolism will always try to find a way to bring your kilograms back. So if you can make those changes in your life, I mean, for the first few years, that it's not going to be a problem. Next year when we do another video with you, you'll be like a mannequin. Okay?
I hope so.
That's for sure, because you're tall, you're fit, you're young, and that's gonna happen. But in order to preserve it, then you need to work on it. Okay?
Okay.
So otherwise, you may need another surgery. That's also an option. But of course, we don't want that. You already faced a certain amount of risk having this operation. I mean, you were a very, very, very low risk patient, because you weren't very heavy, you were young, you know, you weren't a heavy smoker, so you are one of our best patients. So
thank you.
You are a very low risk patient, and nothing happened throughout the procedure, and now you're going back. When are you going back?
Yes, I'm going back on Thursday. Today,
so how many days totally you spend in Istanbul? Today is 6th day after surgery.
6th day.
We normally
+2.
tell people that on the 6th day, 7th day, you can go back to work. You feel like you can go to work right now.
Yes,
right?
Of course.
That's important for other people to know.
My operation was last week, Tuesday. Today is Tuesday.
Yeah.
And I'm very fit.
Yeah.
And I want to say that this operation doesn't hurt. It doesn't hurt.
Because there is no incision. Most pain syndromes occurring after any particular surgery is associated with incisions. Since all of these laparoscopic procedures are being done through tiny holes, that's why you don't feel pain. Yeah.
I'm feeling fit. I feel fit like I long time doesn't feel it, and that is between 1 week for me a big result.
Yeah.
And I'm very glad, I'm very happy, and I'm very happy that I chose this clinic and Istanbul Bariatrics, because the organization was top, the doctors are very top, super, and your CV is super. That was the first what I did when I decided to make this sleeve gastronomic operation. And then I looked at the videos, at the patients from the past who were operated, and so I decided to come to you. And I'm glad.
Well, thank you very much for letting us doing this talk.
You're welcome.
Because it may, give some important info for other people who are living here also. But the main thing is like 7 days, 8 days here was enough for you.
Yes,
even
of
for
course.
pre-op checkup, because not in every case we can do it, because in some patients we may ask them to lose certain amount of weight, but in an average risk patient coming from abroad to Turkey for having this operation with us. So you came here on Monday, right? Last week, yes. Monday,
yes.
And you will be going this Thursday. So you'll be staying here around 11 days. This is more than enough.
Of course, it's more than enough.
This is the thing that we want for patients coming over here from Europe or Middle East or overseas countries, 8 to 10 days is more than enough. Yeah?
Yes, of course.
Thank you very much.
You're welcome.